absolutely. Yeah, the company officially started right after our PhD. So that's back in 2014, October. So it's definitely like our 10 years mark. But before that, actually, I've been quite dedicated in this journey because it came from a very strong personal inspiration. My grandpa was the victim, did not get a liver for transplant on time. So as a young girl, I found that that's very hard to accept. My mom told me all about transplant. So I see there's some major time issues. So dedicated to my studies before start X-Therma and through my PhD to learn the new chemistry and then really actualize this dream by co-founded X-Therma with Mark together and to making it happen. So very exciting 10 years already. Yeah, so it's always seeded in me, we all understand transplant currently, many organs did not end up for transplant simply because we don't get enough time. So how do we get more time? One thing inspired me is there's a body of research on the Arctic species Arctic fish and also some mammals and some amphibians. They are able to create a new antifreeze and can allow them to survive, not only survive, also thrive in the very cold water and cold environment without ice damage. So that is something I think we really want to understand, but there's not enough chemistry involved in the field. So that's why it triggered me to get into chemistry field and then try to learn molecular level interactions. Can we create something similar to this amazing natural antifreeze that is completely non-toxic, allowing human to take advantage of such? And during my study time, this is always in my mind, but I did not get a chance to really do current research. But right after my PhD, when I founded X-Therma, I feel like this is where my heart is really stayed. I really wanted to get into using a new biomimetic approach to mimic nature's best antifreeze and then go deep into molecular levels and use a new type of chemistry. I found very interesting polypeptoid, and then to allowing us to mimic nature, rival nature's function. Yes, so X-Therma's really built a high throughput platform enabled by this breakthrough chemistry and peptoid, and allowing us to mimic nature's best biopreservation methods and new chemistry and apply for human medical field. So we play in cell gene therapies, bioprocessing, vaccines, tissue engineering, and of course, organ transplants. So I will say in the organ transplant field, we have a product established, XT-ViVo. So this contained antifreeze peptoid we developed, allowing us to tap into the new blue zone, which has never been explored yet for human side, which is a high sub-zero zone below 0 degrees C and above -20 C. Actually, we set up at -5 C because of the high potency and the non-toxic property of our new chemistry, XT-ViVo allowing us to preserve human organs, human tissues at high sub-zero temperature without any ice formation. And combined with this technology, we'll also build a smart transporter, and this called TimeSeal. TimeSeal is a plug-and-play small transporter and purposely designed to make this temperature last as our desired duration. So combination of such, and then we receive the FDA breakthrough designations on device side. Potentially, we can move the dial from the currently kidney can only be preserved with less than 24 hours to potentially 120 hours. Yes, so Since my grandpa's time, we all understand every single transplant professionals is fighting against the clock. Time is the most critical component in transplant. So in fact, with this combination system, we're able to completely remove time off the equation. So what is most amazing here is because we fundamentally taking care of the lower temperature side effect, so allowing us to fully take advantage of this new blue zone. So metabolism rate got quenched without needing perfusion system and without needing any a cumbersome procedural change. The transplant surgeon get to use what they've been trained to do transplant instead of using the UWHTK solutions throughout. So we can change it into XT-ViVo from a back table flush. And then instead of using a traditional igloo cooler with white ice, now we have TimeSeal and the combination of both. And this can totally move the time of the equation so we can tap into the organs not expected to be transplanted now can be transplanted to the patient and start saving their lives, and also can potentially move the transplant procedure as elective procedures. So giving the time back to the transplant professionals' family as well. Absolutely. So again, this is coming from our breakthrough proprietary chemistry platform. So this type of molecules are also now already being full commercial, into cell gene therapy field. A cell gene therapy field really rely on the centralized manufacturing and the scale up and scale out. Those sensitive therapeutic cells cannot be well preserved with using DMSO, as the well-known molecules since the 1960s. We've been using them to freeze the cells, but currently have a lot of issues because it's unprecedented toxicity, especially to in vivo setup for patient side, also giving a lot of scale up side nightmares, headaches. Every single engineers we talk to rather not to use a DMSO. So long story short, X-Therma now fulfill this blank. So XT-Thrive is our flagship product that exactly serve the unmet need in this market. So completely remove the DMSO, but we do not compromise the performance. So you can think about the CAR T cell therapies and MSCs, iPSC, HSC, you name it. All those primary cell therapies now can be preserved well with a complete non-toxic solution and deliver the best potency viability to the patient side without the side effect you always see from DMSO. Yes, that's a great question. So I'm very excited about this this current period. I think we have a nationwide recognitions how important we need to take next step to improve the transplant efficiency and to improve the transplant volume towards to our patients. Well, I'm really vouching for all the new technologies that we're currently developing. So we see, as you mentioned, potentially xenon transplant and also 3D printed organs. Also, someone's working on long-term organ bankings. But we see only we bring the technology all together to play as a whole. And in the future, we can actually establish a centralized organ repair, recovery, and rejuvenation centers, just like a cell gene therapy. If you talk about 10 years ago, if we see now we can completely cure leukemia, probably nobody gonna believe us. But now we see it's really become a reality. That is the future of regenerative medicine. We see organ as the biggest regenerative medicine. Eventually we'll get there. So X-Therma, we're very excited. So we can be a great partner for all those new technology developers. So because our work is really about the remove time of the equation, once we have a centralized manufacturing for the organs, so we can take care of from a patient side to manufacturing to the donor side, really build this bridge of life and using very simplified methods and no cumbersome procedures, remove time equation with this pristine technology. So we'll see in the future, probably there will be a lot more volume and we can enable the global organ sharings, no matter it's natural organs, xeno organs, or engineered organs. This is gonna be a new world and we can save millions more lives.